There's a lot of data that comes at you daily about COVID-19, and sometimes the information changes after it was made public.
We will begin, as we always do, with a quick
On Wednesday,
picture of the
Governor Gina
data. And
Raimondo
as we please
outlined the
put
bad
that up
news
on the
early in
screen.
her briefing.
Very sadly, another 11 deaths.
But if you happen to be looking at the data we track closely on WPRI.com, you'd see the numbers were different, with only 2 people dying that day. It was spotted by Liz, who wrote, "I'm looking at your deaths day chart, and it doesn't track with what I thought was reported."
She's spot on, Tim. There is a discrepancy
Target 12
between what's being
investigator Eli
talked
Sherman
about.
built our track cases page and sees the difference in numbers daily.
On the surface, you'd think, oh, okay, 10 people have died yesterday. But in reality, what that just means is that they've confirmed 10 people over some recent period of time have been confirmed to have had COVID-19, and thus it was a COVID-associated death.
In other words, it can take time to determine a cause of death, so the governor
These are the
announces
areas
fatalities
that
when
we
they are
have to keep
confirmed
our
to
eye
be
on.
linked to COVID, but our data shows the day the person actually died. We've also learned sometimes someone will die and they had not yet been tested for the disease, so the state orders one.
So if that happens, as you know, Tim, it could take a few days for the results of that test to come back.
The Department of Health is constantly updating numbers retroactively, not just with deaths, but with tests and hospitalizations as well. We are always monitoring those changes and looking into them every time the numbers are modified, and we are constantly keeping the data updated on the Track Cases page of WPRI.com. With the Target 12 investigators, Tim White, Eyewitness News.